Hey everyone. I wanted to share with you a little bit about what I do as a physical therapist. And I've changed a few things recently, and I'm getting some cool results. And I just wanted to share it with you about exercise. And so, a lot of times when people come to physical therapy, some of the expectations is that they're going to get a load of exercise and education, and that's going to help fix the problem, which in a lot of ways that's very important and it does help. But what I've been messing around with lately is when you look at the current neuroscience and you look at how the brain is conditioned and how you can condition the brain to cooperate. I kind of have been messing around with the thought of exercise isn't the most important thing I can do for my patient. And so I'm going to give you an example. I had a patient just recently where there was a problem in his hip, and so I do some hands-on treatment. Luckily, the diagnosis was pretty clear that it required a specific manipulation. I manipulated the joint, and he got pretty significant relief. The cool thing was when he stood up and he's walking around, you see that there's this weird look in his face, and he's like, it almost feels normal. And he said it almost moves as well as the other side. And so what this patient was recognizing is that what we've done in the small bit of treatment that I did with him was restore his normal function. The problem with this is that the brain doesn't necessarily consider that normal. It considers it altered because for months now he's had this problem, and for months now his body's been operating a specific way. So with this, he felt a change, felt a shift. He was happy, but I'm predicting it wouldn't take much. It could be a stressful work phone call. It could be family stuff, whatever it is. It could be any of those things to stir him up a bit to where now his mind faces stress and kind of takes him right back to where he was and back to his old normal. So what I did with this patient was I said, hey, I want you to really be mindful and feel this and experience what this feels like to you. And he did. He took the time, and you could see he was really enjoying it, and it was kind of cool to watch this experience. And then instead of giving him corrective exercise, which in theory, in the long run, he needs corrective exercise, but at this moment, he needs more of just mindfulness retraining. So I asked him to go for a walk. And so I asked him to go for a 10-minute walk and just be massively mindful of how the hip is functioning, how the hip is working, how it feels to walk with normalcy. And reprogram your brain that is normalcy. So what the patient was doing was he was getting functional movement of walking, and while he's functionally walking, he's also repeating in his mind and in his brain that this is actually normal. So what he's doing is he's retraining the brain what is his actual normal. So I feel that, especially for the first visit and maybe more, that this is probably one of the best approaches to initiating physical therapy, in the sense of you're getting the brain on board. And once you get the brain on board, and it understands what you actually want, then everything else you give the person should, in theory, respond a lot better, because the brain is already aware of what you're actually wanting to do. If the brain kept on going back to old realities, the chances are you wouldn't see the results the way that you potentially can when you're resetting your normal. So it's a different concept for me. I've been using this for a while, but I've started to put more emphasis on it, and I feel that it has been beneficial to the patient, and I think it's speeding up my outcomes. So give it a whirl. Let me know what you think. All right, take care.